After a radical prostatectomy, all men will have some degree of urinary incontinence immediately after surgery and the catheter comes out. Now, it's true that most men will regain their continence function. Most of the recovery of continence will happen within the first 6 months. By 12 months, about 90% of men will regain their urinary continence or urinary control. For the 10% of men that don't regain control of urinary continence, we certainly do have options to help fix this problem. For men that have mild incontinence, mild to moderate incontinence, they can be candidates for what's called a male urethral sling procedure. For men that are experiencing severe incontinence, essentially going through lots of urinary pads or even depends underwear, those men will be better candidates for what's called an artificial urinary sphincter. Now, as we saw earlier today, this gentleman had a urethral sling procedure with me 6 months ago, and the urethra looks perfect under cystoscopy after completion of that sling. After a radical prostatectomy, all men will also experience erectile dysfunction immediately. And that's once again because of the nerves that control erectile function are enveloped around the prostate, almost like a shawl. And so even if you have a nerve-sparing prostatectomy, it does take quite a while in order to recover your erectile function. Men that go into the surgery with excellent erectile function have a higher chance of recovering most, if not all, of their erectile function. However, men that go into this surgery with poor erectile function are unlikely to recover their erections. Generally, we will go through a penile rehabilitation program that allows you to recover your erectile function in the first 12 to 18 months. Usually, our literature suggests that men will typically recover their erectile function within that time period. If for some reason you have not recovered your erectile function within 12 to 18 months after surgery, there are many options available to you in order to regain the confidence and restore intimacy.